So hello everyone. Welcome to this channel. So today we'll be learning about otosclerosis. Auto means air and sclerosis means hardening. Okay. So basically you have your foot plates of stipes, right? So like this, you have your foot plates of stipes. Okay, this is your foot plates of stipes, the one which I have highlighted like this. Okay, so this is your foot plates of stipes. Now this foot plates of stipes actually it undergoes a change. Okay, so what changes it? It undergoes a change and it undergoes it is this bone is actually this bone which is actually it actually goes under a change and it actually forms an spongy bone. Okay, so it's an end condyle bone and it actually forms spongy bone. So from this, the change from end condyle bone to spongy bone, this area where this change is happening, okay, the change that is happening, this particular time is actually known as otospongiosis. Okay, otospongiosis. Spongiosis means an active phase. Okay, it's an active phase. And sclerosis actually means it's actually a phase where there is hardening. Okay, there is hardening. So at the stage of otospongiosis, whenever you see the tympanic membrane, it looks pinkish. Okay, so it's a red color, so let me use a pink color. You also use a pink color in your note copy, so it looks pinkish. Okay, so this is known as a flamingo pink sign. Okay, and it's also given other name as, this is also known as squat sign. Okay, squat sign. Okay, flamingo pink sign, or it is also known as squat sign. Now remember that history. What is the history? Basically, a 30-year-old pregnant woman comes to the department of ENT and says that she doesn't hear anything. Okay, she doesn't hear, but she hears it in better environment, hears in noisy environment. So this hearing in noisy environment, it means paracusis willisii. Okay, this word you need to remember. This is a phenomena which is known as paracusis willisii. And the foot plates of stipes, it is actually fixed. Okay, fixed means this end condyle bone, now it will actually convert into spongy bone. Okay, it's end condyle bone, it will convert into spongy bone. Now otosclerosis can lead to conductive hearing loss. It's actually a feature, it's actually a component of conductive hearing loss. But if otosclerosis leads to your cochlea, so usually it is restricted to your foot plates of stipes. Okay, but if it involves the cochlea, okay, if it's involved the cochlea, that is known as cochlear otosclerosis, and that will lead to sensory neuron hearing loss. Very good. So blue mantle of Manasseh. So what is this blue mantle of Manasseh? Blue mantle of Manasseh is actually it is actually postmortem finding. So whenever you go for a postmortem examination of patient having otosclerosis, you will see blood vessels. Okay, you will see blood vessels and you will see surrounding new bone formation. So this is new bone formation surrounding. So this is actually known as blue mantle of Manasseh. Okay, so the bone actually looks bluish, so you can just make a blue color like this, blue mantle of Manasseh. Okay, please correct the spelling of squads. Okay, it's SCHWARTZ. Okay, WARTZ. Okay, R is missing here. Okay, so SCHWARTZ. So it's also known as squat sign. Okay, so what are the risk factors? So I already told you in this particular above slide that she is a pregnant. Okay, so this pregnancy is itself a risk factor. Okay, pregnancy. So she can be a factor, a component. She can be affected with measles. She can be affected with autoimmune disorders. Now what autoimmune disorders? So you need to remember Van der Hoef syndrome. Okay, so what is Van der Hoef syndrome? Van der Hoef syndrome consists of a triad of otosclerosis, blue sclera, and osteogenesis imperfecta. Okay, so this is a Van der Hoef triad, and you need to remember this. So any person who is having a Van der Hoef syndrome with otosclerosis, blue sclera, and osteogenesis imperfecta, so these is also one of the risk factor. Okay, now next thing that you need to write over here, that is, I already told you it's more common to pregnant, and it is a bilateral condition. it's a bilateral condition, whereas Meniere's disease is a unilateral condition. Can you tell me one more bilateral condition which leads to sudden sensory neuron hearing loss? Of course, it is ototoxicity. Okay, one more, it is presbycusis. Okay, so it's a bilateral condition. Bilateral conductive hearing loss will be seen. So if you do a Rinne's test will be negative. That means normally air conduction is more than bone conduction. This is seen in a normal ear as well as a sensory neuron hearing loss. But Rinne's negative means bone conduction is more than air conduction. This happens in otosclerosis or any kind of conductive hearing loss. Okay. Next, I order a Weber's test. In the Weber's test, I can see that it is lateralizing to the better ear. Now, why is this so? Because in the better ear, there is a masking effect. Next thing that you need to remember, that is, whenever I talk about otosclerosis, you should not forget the PTA finding. In the PTA, there is a notch at the 2000 hertz. Okay, so it might be like this. This might be your air conduction. This might be your bone conduction, right? So there is a notch. Okay, there is a notch. This notch is known as a Cahart's notch. Okay, please make this as bone conduction, this as air conduction. Okay, because this Cahart's notch is seen in bone conduction. Okay, and air conduction is above, then there will be a prominent AB gap. AB gap justifies that there is a conductive hearing loss. Okay, now there's a special test known as Galli's test, specially designed for otosclerosis, where you use a seagull speculum. What do? You put a tympanic membrane and you vibrate it, and then you put it in your mastoid. Okay, and then you inflate the seagull speculum, and then you ask whether there is change of sound or not. The sound should actually decrease. If there is no change, this is a case of otosclerosis. Okay, so biorhythmic tuning for raise and keep it at the mastoid. Raise the pressure with the seagull speculum. If the loudness decreases, it is seen in normal hearing and sensory neuron hearing loss. Okay, but if it is case of otosclerosis, there will be no change. Okay, similarly, you can also go for a tympanogram. So if you go for a tympanogram or tympanometry, you will see a AS type of curve. That is the curve which is slightly down. This is a AS type of curve. Okay, AS type. Okay, great. Now you can also go for absolute bone conduction test, and it is actually same as the examiner. Why? Because this is not a case of conductive hearing loss. Sensory neural hearing loss. Later it might become, if it involves the cochlea. You can go for an HRCT. So what you will see in HRCT? In HRCT, you will see that there is a double ring sign. So how are you going to manage a case of otosclerosis? So any patient who comes with a history of otosclerosis, okay, you examine the patient. Okay, so if it's an active disease, that means there is otospongiosis. You're not going to operate the patient because there will be vasodilatation. If you operate the patient, there might be high risk of damage of blood vessels, and there might be hemorrhages, right? So in this case, you'll go with sodium fluoride. So what will sodium fluoride do? It will increase osteoblastic activity, and it will decrease the osteoclastic activity. Similarly, you need to understand about the theory for sodium fluoride. Sodium fluoride is not just given in the case of active otospongiosis, it is also given in the case of pregnancy. Okay, if someone's pregnant and we don't want to operate to that patient, we don't want to operate on patient, then we contraindicate surgery. We contraindicate surgery and NAF also. Okay, NAF also. I'm really sorry on this. Okay, So if someone is pregnant, okay, I don't want to give NAF, I don't want to go for surgery. Okay, I will wait until the delivery happens, and after delivery I will go for a surgery. After delivery I will go for surgery. Okay, so sodium fluoride, it is used in the case of active disease. Okay, it is used in the case of active disease, and also it decreases the release of proteolytic enzymes. Proteolytic enzyme activity will be decreased. Okay, so you need to understand the mechanism action of sodium fluoride. So what can the surgery be? The surgery is of two types. One is otosclerosis. One is stapedectomy. Other one is stepidotomy. So what does this mean? Stapedectomy means, particularly you have, this is your stapes, this is your foot plates, you have your stapedius muscle over here. You cut the stapedius muscle, you remove all of the stapes, and you create a small window type of thing over here in your outside a round window, so that sound can actually travel, right? There's high risk of fistula formation, so you can make a window over here or in the lateral semicircular canal. You just make it, right, so that sound can go to the inner ear. And there's high risk of fistula formation, high risk of SNHL. We do not do this surgery now. What we do is stepidotomy. That means we leave the foot plates of stapes behind like this. So we just remove this stapedius, we just cut the stapedius muscle, we just remove this one, right, this one, the stapes. And then the foot plates of stapes, there is a slight hole made, and a probe is fitted over here. And what is this probe made up of? It is a Teflon or it is a titanium. Either it's a Teflon or it's a titanium. Okay, and it is actually hooked to the long process of incus. So here you'll have your incus, and it's hooked to the long process of incus. So what will be the risk? This long process of incus is at very high risk whenever there is AOM or any pathology in your inner ear, okay, where there is fluid collection, infectious fluid collection. This area, the lenticular process of incus is in a watershed area. That means this area receives very less blood supply. So what happens is, this area is highly prone for necrosis. Okay, necrosis. That is why this area can actually undergo necrotic change on a long run, and that is one of the complications of stepidotomy. Okay, and similarly on whenever there is an active sclerosis, I already told you if there is spot sign, you have to give sodium fluoride. Okay, what is the contraindication of NAF? So I wrote your indication, right? So when there is an active disease, do not give NAF, right? So what is the contraindication? One is pregnancy. Okay, pregnancy becomes one of the contraindication for NAF. So NAF is not given in pregnancy, it's not given in the renal disease. Okay, it's not given in rheumatic arthritis, it's also not given in skeleton fluorosis. Okay, contraindication of surgery, I already told you, one is pregnancy, other one is active otosclerosis. The next one is contraindication is if it's a only functional ear. For example, 2 years are there. I know that otosclerosis is a bilateral condition. There is a bilateral hearing loss. Okay, progressive conductive hearing loss is bilateral. But if in case it's over here, okay, this side has slight this ear has totally become dead. Okay, suppose the prognosis was bad over here, totally dead. On only otosclerosis there was SNHL, totally dead. This ear is only functioning, and if you operate in this ear and this ear becomes dysfunctional, this ear becomes dysfunctional, there is no use of going for a surgery, isn't it? That is why we do not operate to a patient who is only having one functional ear. Okay, one functional ear. Are we getting this point? And similarly, we don't want to go for surgery in someone who is having Meniere's disease. Why not? Meniere's disease. So someone who is having an endolymphatic hydrops, okay, endolymphatic hydrops, or also Meniere's disease, what will happen? The utricle and the sagittal is dilated, right? And if you put a piston over here, there's high chances of, and of course I already told you the stapedius muscle is already cut during the surgery, right? And there is no check and balance, and that will actually lead to excessive movement of the stapes towards the this one, right? So utricle and sacral, and that will lead to severe vertigo, and I don't want the patient to suffer, isn't it? Vertigo. That is why I do not go for a surgery in the case of pregnant, in the case of active sclerosis, in the case of Meniere's disease, and also occupation like pilots, because there's a lot of pressure changes, right? Pilots and deep sea drivers. Deep sea drivers. Post operatively, how can you assess the patient? Just go for a tympanogram. Post operatively, you see a AD type of curve, okay? AD type of curve. Because the AD type of curve is seen, okay, post operatively. And the Cahard's notch, it disappears, okay? It disappears. Now, what would be the cause of post operative hearing loss? I already told you there might be necrosis of the long process of incus, number one. Number two, the piston might have dislodged. Okay. Or number three, what can happen is there can be a fistula. There can be simply a fistula formation, okay? And of course, I already told you complication. There are a lot of complications of surgery, but the major one, which is very, very important not to be missed, is number one is fistula formation. Number two is trauma. Trauma to what? Trauma can happen to the facial nerve, and the patient may present with Bell's palsy. Okay. So in a nutshell, otosclerosis is the disease of pregnancy. It's a disease of measles. It's a disease of autoimmune condition. It means ear. This means hearing. Sclerosis, hardening. Foot plates of stapes. It actually has an end condyle bone. This is actually converted into spongy bone. And during this process, this area becomes highly vascularized, because of which you will see flamingo pink sign, or this is also known as Schwartz sign, right? When you go for a tympanogram, you will see a AS type of curve. Whenever you go for a PTA, you will see a Cahard's notch. The female will give a history that she hears in a better environment, which is known as Paracosis willisii, isn't it? Similarly, whenever we talk about blue mantle of Manasseh, this is actually biopsy finding, autopsy finding, where you'll see blood vessels surrounding which there are bones, right? Okay. Similarly, if you just even write blue mantle of Manasseh as a postmortem finding, it's very good, okay? Similarly, Van der Hoff syndrome is very important to understand. Otosclerosis, sclera, and osteogenesis imperfecta. It's a bilateral condition. I've already talked about the Reni's, the Weber's, okay, the absolute bone conduction test, the Galley's test, which is specific for otosclerosis, the tympanogram, the PTA, HRCT, double ring sign in HRCT, double ring sign in SRCT. Very, very, very important phenomena, okay? This completes our topic of otosclerosis. Please do like, share, and subscribe. Thank you. Please do comment if you have any suggestions. Thank you.